Do you ever need an ultrasound of your knee?
Short answer is no, but maybe.
Good video. Welcome to Talk with Docs. I'm Dr. Brad Winnie.
I'm Dr. Paul Salza. Ultrasound rings close to my heart. Do you know why? There's no way you could know why.
Because you had an echocardiogram?
No, I didn't.
I know.
Yeah, no, but that's not why.
Oh, yeah.
Oh, rings close to my heart.
Yeah. See what I'm doing there?
Get it.
Yeah.
No. In engineering, in our fourth year, we had to do a thesis.
Okay.
And my thesis was using ultrasound to try and look at blood flow, specifically the transition from laminar to turbulent flow. Then I parlayed that into a master's. So I used ultrasound as part of my master's.
Wait a second, your master's wasn't on the benefit of ultrasound assessing intra-articular knee pathology?
No, it was actually using Doppler ultrasound.
Oh.
Not to nerd out on you, but Doppler is the phenomenon of a wave. The shift in wavelength is proportional to the velocity between the emitter of the wave and the receiver of the wave. That's how we use
Even when you try to not nerd out.
No, to really nerd out. Doppler was it 1862 or 1842? 1842, Doppler, an Austrian physicist, mathematician, discovered the Doppler effect.
Yeah.
And this is the nerdy part. Me and some friends from engineering.
This is the nerdy
This
part?
coming up.
Okay.
We were backpacking through Europe, and we made a point of going to Austria so that we could get a picture of us in front
Some
of...
people go to Zanzibar, some people go to Amsterdam. Paul and his
we
engineering
got a
buddies
picture
go to
of
Doppler's
ourselves in
place.
front of Christian Doppler's house.
There you go.
Because it's still there.
So awesome.
Doppler effect. So Doppler is a phenomenon of ultrasound, but that's not used in knee.
Okay, so we're
ultrasound.
talking about ultrasound because as orthopedic surgeons, I would say I don't order them, but I have to deal with them.
Yeah, ultrasound of the knee. I'm going to say right out the bat.
Okay.
Ultrasound of the knee is almost completely useless.
Yes.
Except for a few conditions. One, if you're looking for an extensor mechanism disruption, that means you've fallen, you tripped, something happened, and you can't lift your leg up straight. Did you rupture your quadricep tendon or your patellar tendon?
So your quadricep tendon attached to your kneecap at the top, your patellar tendon connects your kneecap to your shin bone, and if either of those is disrupted, you cannot straighten a bent leg.
Right, and that we can make that diagnosis clinically.
I would say, yeah, you probably don't even need an ultrasound there, but the degree potentially.
Yeah,
yes.
but if you're going to get an ultrasound, that's one reason to look at that disruption,
Okay.
although it's usually clinical. The other reason is if you have a mass around your knee and we're looking to see if this is a tumor, an ultrasound can be helpful to see if there's blood flow to it, to see if it's solid or not.
And more commonly than not, you would find out actually that you had a cyst, a popliteal cyst, or a Baker's cyst.
Yeah.
But this is not a reason to have an ultrasound necessarily.
So in the absence of these conditions, an ultrasound is useless. Your doctor ordered an ultrasound for your knee pain that you've been having for several months or a year. That's useless.
Okay, wait. So someone's going to say, well, wait, what about ruling out a DVT?
That's not a knee ultrasound. That's
Right.
a leg ultrasound.
Okay,
That's looking
ultrasound
for
of your calf.
Yeah, and you're looking to see if you can squeeze the veins there, because if they don't squeeze, there's a clot in there.
Very important test for us. We do it all the time.
Okay, so I don't know why this is happening. I don't know why we're still ordering ultrasounds of knees. I don't know why the radiologists are doing them.
Okay, so can I
They
tell you
know
why?
they're useless too.
I'm going to tell you why.
Why?
Because a patient comes to someone's office, not ours, but someone before us, before they get referred to us, and they say, I got knee pain, and the x-ray shows like a little bit of arthritis. I'm like, well, something else is going on. I need some more tests.
Yeah.
And they say, okay, well, we can order an MRI, but an MRI, A, is expensive in the United States, and here sometimes takes longer to get, depending on the severity of the pathology. So sometimes physicians feel obligated to do something.
Oh.
And I think they say, oh, you know, let's just get an ultrasound.
Oh.
Right? And then unfortunately, then you get the report, and it has a whole bunch of words on it, and then you come to us and you're like,
I go like this. I throw it away immediately. They say, do you want to see my ultrasound? No. Because it's useless.
okay.
So tell your doctor, no, I don't want an ultrasound of my knee. I think that's fair. Unless you think I have a tumor or an extensor mechanism disruption.
Right. Because it will comment, it'll say, hey, there may be a torn meniscus. So let's talk a little bit. So ultrasound technology, let's talk about what it is.
Ultrasound technology is using sound waves to bounce off objects and to create an image. So you hear sound in the 20 hertz to 20 kilohertz range. Ultrasound is in the 5 megahertz to 100 or 150 megahertz range. 5 to 15 megahertz is the lower range of ultrasound. That's good for deep tissues, looking at things in the abdomen, far away. The high frequency is a smaller wavelength. Smaller wavelength means more resolution. So superficial things we can look at, like breast lumps, things like that. So there's a role for ultrasound in medicine. It's huge. It's just
even
not
your appendix.
So that's ultrasound for imaging.
But in the knee, the important stuff's really not on the outside; it's on the inside. And you just
Internal,
can't
yeah.
get deep enough to comment on
Yeah.
your meniscus, your articular cartilage, your ACL.
It's useless. You need an MRI to look at the internal derangements of the knees. Okay? Insist on an MRI. If you're worried about some internal derangement, then you need an MRI. However, if your X-ray shows severe arthritis, that trumps everything. Forget
whole
it.
other video.
You
Don't
don't
get the
need
MRI.
anything else. If you have severe arthritis and your knee's shown on X-ray, you don't need any other imaging. Do you have the diagnosis?
But yeah, if I have severe arthritis, should I get another X-ray in 6 months?
No.
I know people are like, do another one? I'm like, no.
See if it got better.
Yeah,
It's not going to get better.
Go and your tires are bald. If you go look at them 3 months from now, they're still bald.
Yeah.
There's no extra tread growing.
No.
Okay, so
and an ultrasound, great for imaging things in the body. Amazing, just not the knee.
So the video seems a little trite, and it's a bit tongue-in-cheek. Like we're not.
Yeah.
It's by design because we want the message to be. Ultrasound is not a useful test for knee pathology unless it's a tumor.
Orthopedic surgeons watching this video, you're welcome. Any family physicians or primary care physicians watching, we're sorry to tell you, don't get the ultrasound. Any patients who wasted their time getting an ultrasound of their knee, sorry.
Right.
Okay, that's just the bottom line.
Now you know. If you like this video, please like it, subscribe to our channel, leave a comment about your experience with getting a knee ultrasound, because a lot of you have probably had one.
Many people have had them and they just do not contribute to your treatment plan.
There you go.
Anything we miss? Tumor, extensor mechanism disruption,
Yeah.
DVT, we talked about, that's not the knee, that's the leg.
That's it.
I just want to say we're leading people the wrong way.
Maybe it theoretically assists if you had a really peripheral, like meniscal cyst, but
clinical diagnosis.
Yeah.
Remember, you are in charge of your own health.
Even-
and now you're
even
in charge,
more so.
You're in charge of whether or not you're going to get an ultrasound of your knee.
We'll see you next time.